Sometimes you'll go to a doctor and you'll have a knee pain, and the first thing that will be done is X-ray or MRI to look at the structural damage to the knee. And although these structural things can exist, like torn meniscus or osteoarthritis, muscle can really be the culprit that's causing the pain. And if we can eliminate the pain, it doesn't really always matter what the underlying pathology is. Dr. Brian Kelly and I work for the New York Giants, and from an orthopedic standpoint, Dr. Kelly is one of the country's leading experts with hips, knees, and shoulders. And we found early on that doing the muscle work in conjunction with the surgical procedures, we had great results. So in some cases, patients present with what would be known as a labral tear, which is the cartilage inside the hip gets frayed or torn. What we found early on was that not every one of these patients needs surgical intervention. Although some of the patients do very well under surgical intervention, other patients do very well with conservative therapy. We started to collaborate to write this book to explain to the patients and explain to the general public that there could be hope, even though there's an underlying structural pathology, that treating the muscle might relieve most of the pain. Every chapter has a self-treatment, a stretch, and a strengthening section. The self-treatment is a hands-on approach which is revolutionary, in which we shorten muscles, apply pressure on that muscle, and then lengthen under pressure. So you have a self-treatment section, and then you have stretches which are predominantly active stretch. Active stretch differs from static stretch. A static stretch is when you would stretch a muscle and then hold it. Active stretch is when you stretch and release. We find that to be much more conducive for helping these muscles heal and get blood flow. And then there's a group of strengthening exercises in every chapter that show you after the muscle has been broken down and functioning properly, how to strengthen it. What we hope people take away from muscle medicine is that just because you're getting older, and just because as an athlete you might have an injury, or just because you're sidelined right now with a problem that might seem grave or a little overwhelming, if you treat the muscle and you do stretches and you do strengthening, you might overcome this problem a little faster than you thought so.